Adrenal insufficiency turns the simple concept of stability into a moving target, and for most people living with it, the harder they try to hit the bullseye, the more it seems to shift. We're talking about a disease where you can do every single thing right, the pills, the timing, the tracking, and still wake up feeling like you've been run over by a truck. Evelyn, there's this central tension in how we talk about stable versus how it actually feels, isn't there?
It's a massive gap. In a clinical setting, stable usually just means your labs are okay and you aren't in an emergency room with an adrenal crisis. But if you ask someone living with it, stability isn't a flat line. It's more like navigating a small boat in choppy water. Even if you're a great sailor, the waves are still going to hit. And I think the article from My Adrenal Life hits on something vital, that we've been using the wrong definition for success. We've been looking for a fixed point when we should be looking for a manageable range.
Right, because cortisol isn't just one thing. It's the body's primary responder to, well, everything. Stress, light, lunch, a loud noise. If the system that handles that response is manual instead of automatic, of course it's going to be messy.
Exactly. The body is a dynamic system, but our replacement therapy, usually just hydrocortisone or prednisone, is incredibly blunt. We're trying to replicate this elegant, second-by-second hormonal dance with a couple of pills a day. Research in the Journal of Clinical Endocrinological and Metabolism has shown that even with perfect dosing, we can't fully mimic the natural circadian rhythm, so you end up with these peaks where you have too much and troughs where you have nothing. Stability, in that context, can't possibly mean feeling the same every day.
It's funny how we use the word stable for something that's basically a high wire act. If the wind blows, meaning you get a cold or have a stressful meeting, the wire shakes. But the expectation from the outside, and often from the patients themselves, is that once you have the right dose, the wire should stay perfectly still.
And that expectation is where the psychological weight comes in. If you think stability is a flat line and your life is a zigzag, you start thinking you're doing it wrong. You think, I must have missed a sign, or maybe I'm not disciplined enough. But the reality is that the zigzag is the stability. It's the range of a managed chronic condition. If we don't redefine that, we're just setting people up for a permanent sense of failure.
So let's pull that apart. If stability isn't a fixed state, what are we actually looking at? The article mentions stability as a range. That feels like a subtle shift, but it changes the whole goalpost.
It's a huge shift. Think about it like a thermostat. In a healthy body, the thermostat is high-end. It detects a tiny drop in temperature and adjusts instantly. In adrenal insufficiency, the thermostat is broken. You're manually throwing wood on the fire. Sometimes you get it too hot, sometimes it dies down. Range-based stability means accepting that the room temperature is going to fluctuate between, say, 65 and 75 degrees. You stop panicking at 68 because you realize you're still within the safe zone.
But that's hard to sell to someone who just wants to feel normal again. There's a grief there, isn't there? This realization that normal might actually be a series of controlled wobbles.
Oh, there's deep grief. And a disconnect with the clinical side. Doctors look at a 900 AM cortisol test or a stable weight and say, you're stable. But the patient is thinking, I had to sleep for 4 hours after grocery shopping yesterday. How is that stable? A 2024 study in Endocrine Abstracts actually highlighted this. Fatigue persists in nearly 100% of cases, even when the labs look good. That tells us the clinical markers aren't capturing the full picture of what it means to live in that body.
Wait, if the labs are fine but the fatigue is 100%, does that mean the replacement isn't working? Or just that it has a ceiling?
It has a ceiling. Natural cortisol has an ultradian rhythm, tiny pulses every hour or so. Pills give us these huge mountains of hormone that then vanish, so you're constantly bouncing between too much and not enough. The patient is living in the gaps. That's why we see the boom-bust cycle mentioned in the text. You have a good day where you feel 70% of your old self, so you try to catch up on everything: laundry, emails, exercise, and then you spend the next 3 days in a bust phase because you overextended your very limited biological budget.
Oh, I'm not sure I buy that the boom-bust cycle is just a biological budget issue. Is it possible that the way we track things is actually making it worse? Like, if I'm hyper-fixated on every dip in energy, am I actually making the bust feel heavier because I'm overanalyzing it?
That's a fair push. There is a psychological feedback loop. If every dip feels like a failure of management, the stress of that failure actually consumes more cortisol, which makes the dip worse. It's a self-fulfilling prophecy. But I don't think it's just overanalysis. There's a physical limit to how much stress, even good stress, like a fun outing, the body can handle when it can't bump up its own cortisol levels. The boom is often just borrowing energy from tomorrow.
So if we accept that borrowing is part of the deal, does that change how someone should pace themselves? The article talks about pacing being about awareness, not restriction. That sounds nice on paper, but in practice, isn't awareness just a polite word for "I can't do that"?
No, I think it's more about strategic spending. If you know you have a limited capacity, you don't stop spending. You just stop spending on things that don't matter. The article suggests noticing early signs of depletion. Most people wait until they're crashing to stop. Pacing within a range means saying, I feel my blood pressure dipping slightly, or I'm getting that specific brain fog, and stepping back then, before the floor falls out. It's about staying within the 65 to 75 degree range we talked about, rather than letting it hit 40 and then trying to blast the heat.
That sounds like an incredible amount of mental labor. You're essentially acting as your own endocrine system 24/7. That isn't just a physical burden, it's a cognitive one. You're always on, monitoring for the slightest shift.
It's exhausting. And that's a part of the stability discussion that often gets ignored. Clinical stability doesn't account for the management tax. The sheer amount of thinking it takes to stay stable is, in itself, a stressor. Recent quality of life surveys show that patients with secondary adrenal insufficiency, often caused by pituitary issues, actually report even lower quality of life than those with primary Addison's, partly because the fluctuations can be even more unpredictable.
Is it possible we're overcomplicating this? I mean, if the replacement dose is right, should it really be this hard? I hear you on the management tax, but I wonder if the real problem is that our benchmark for stable is just too high for any chronic illness.
Well, look at the data. A study in the Journal of Clinical Medicine found that health-related quality of life is significantly reduced even when replacement is optimal. That suggests the benchmark isn't too high. The tools are too limited. We're using 1950s technology, steroid pills, to treat a 21st century life. So when we tell a patient, you're stable, based on those tools, we're essentially gaslighting their actual experience of feeling like crap. That's why the article pushes for compassionate benchmarks. It's about aligning the goal with the reality of the tool we're using.
So a compassionate benchmark would be what? Instead of saying, I will have the energy to work 8 hours, it's, I will manage my energy so I don't need a 3-day recovery?
Exactly. It's shifting from, did I do everything I wanted to do, to, did I stay within my range? It's about recognizing that recovery time isn't lost time. It's actually part of the functioning cycle. If you have an endocrine disease, your recovery is a biological requirement, not a moral failing. When you stop seeing the bust as a mistake and start seeing it as a necessary part of the boom, the emotional pressure drops.
That's a hard pivot to make when society, and usually your boss, expects that flat line of productivity. We're talking about a fundamental clash between how a body with AI works and how the world works.
It's a massive clash. The world is built for consistent output. Adrenal insufficiency is the definition of variable output. And when those two things hit each other, the patient is usually the one who gets bruised. This is why the article mentions the emotional side, the self-doubt and the pressure to meet expectations that just don't match the lived reality. You look fine on the outside, So people expect you to be fine, but internally, you're managing a complex physiological deficit.
It makes me think about the invisible nature of it. If you had a broken leg, people would see the cast and understand the limits. But with AI, the cast is your pillbox and your internal monitoring system. It's all invisible.
And that invisibility breeds isolation. You end up not explaining it because it's too complicated, or you sound like you're making excuses. But as the text points out, your experience is valid even when it is inconsistent. That's such a powerful sentence. It's basically giving people permission to trust their bodies over their lab results.
Trusting your body when it's literally the thing that's failing you? That's a tough sell, Evelyn. If my adrenals aren't working, why should I trust the signals they're sending? Maybe the signals are wrong too.
That's where it gets really interesting. You aren't trusting the adrenals to work, you're trusting the symptoms to tell you the truth about your current state. If you feel dizzy, you're dizzy. If you're exhausted, you're exhausted. Clinical stability says you shouldn't be feeling this, but experiential stability says I am feeling this, so I need to adjust. One is an external rule, the other is an internal reality. Learning to bridge that gap is the real work of living with AI.
So how do you actually do that without losing your mind? The article mentions noticing patterns within a range. Is that basically just fancy talk for keeping a journal?
It's more like becoming a scientist of your own life. It's noticing that every time you stay up late, the next 2 days are a write-off. Or that physical stress, like a long walk, hits differently than emotional stress, like a difficult conversation. Once you see the patterns, the fluctuations stop being random and start being predictable-ish. And predictability, even if it's predicting a dip, is a form of stability. It's the ongoing recalibration the article talks about.
I like that. Predictable-ish. It's not a guarantee, but it's a map. And maps are a lot better than just wandering around in the dark hoping you don't trip.
Exactly. It's moving from a reactive state to a proactive one. And look, this isn't about giving up or lowering the bar. It's about aligning the bar with how the body actually functions. If you're trying to jump a 6-foot fence with a 3-foot vertical, you're just going to keep hitting the fence. If you recognize you have a 3-foot vertical, you find a gate. You still get to the other side. You just do it in a way that doesn't break your neck.
That's a perfect place to land. This idea that stability isn't the absence of a struggle. It's the presence of a strategy. It's not about finding a flat line. It's about learning how to ride the waves.
And acknowledging that some days, the waves are just too big. And that's okay too. That doesn't mean you're failing. It means you're human with a very complex condition. If we can shift the conversation toward this range-based view, I think we'd see a lot less burnout and a lot more resilience in the chronic illness community.
We've spent this time digging into why the clinical definition of stable often fails the person actually living with adrenal insufficiency. Referencing the insights from My Adrenal Life, it's clear that stability is a practice, not a destination.
If you found this conversation helpful, or if it gave you a new way to think about your own health or someone you care for, please share it. Sometimes hearing that inconsistency is normal is the most stabilizing thing of all.